30 days to rebuild your brain. Why is the rehabilitation progress and efficiency of many stroke and hemiplegia patients less than ideal? Based on my experience, the primary reason is that they all miss the critical period for neuroplasticity, typically within the first month after a stroke. Hemiplegia caused by a stroke is essentially the death of neurons or the disruption of neural pathways in the brain's motor center. The muscles themselves are usually intact, but the brain cannot send out commands. Therefore, early rehabilitation training after hemiplegia is not primarily about exercising muscles, but rather about reinstalling the brain's operating system. Without new pathways established through neuroplasticity, rehabilitation becomes like shouting slogans at a machine. Only once neuroplasticity first establishes weak signal connections is there anything left for subsequent repetitive training to reinforce. Rehabilitation trains the signal strength, while neuroplasticity provides the signal path. Neuroplasticity in the early stages of rehabilitation refers to the process by which the brain uses its plasticity to reorganize and repair its own neural network after injury. Undergoing rehabilitation within the first month after a stroke can achieve twice the result with half the effort. This is because brain-derived neurotrophic factor, BDNF, secretion in the brain reaches its peak, which is equivalent to the brain actively releasing growth fertilizer. At this time, neuronal connections are extremely easy to establish, and the brain is eagerly awaiting the correct inputs. Performing rehabilitation while the brain is in a sensitive period of experience expectancy can achieve twice the result with half the effort. 1 hour of rehabilitation training may equal 10 hours of training half a year later. This is the fundamental reason why the rehabilitation community emphasizes the golden period. If this critical period is missed, the efficiency and effectiveness of the patient's rehabilitation training will drop significantly. This is because the brain's spontaneous repair signals, such as growth-promoting gene expression, gradually weaken, while growth-inhibiting signals begin to strengthen. Furthermore, after a stroke, if the patient does not move the affected side for a prolonged period, the sensorimotor functions of the unaffected side will take over the brain map space originally belonging to the affected side. Without the guidance of early neuroplasticity, the brain will undergo maladaptive plasticity on its own, such as over-reliance on the unaffected side and the consolidation of abnormal spasticity patterns. Once these incorrect neural connections become entrenched, the primary task of subsequent rehabilitation shifts to correcting errors, which is far more difficult than building new ones. The early, correct neuroplasticity process involves intentionally guiding neural connections to grow toward functional recovery through proper motor input. In my case, I had a visiting traditional Chinese medicine practitioner begin early rehabilitation training and acupuncture in the 3rd week after my stroke. During times when I wasn't doing physical training, I would often practice motor imagery training on my own, keeping the affected limb still, closing my eyes, and using my mind to repeatedly and attentively imagine the hands or feet on the affected side lifting or moving. Research has shown that this activates the exact same brain regions as actual movement, helping repair damaged motor pathways. At first, patients may feel as if the affected hand or foot is moving, even though it actually isn't. Patients and family members shouldn't feel discouraged when this happens. This illusion is simply part of the process of restoring neural connections to the limb. After a while, as the signals grow stronger, moving the limb will no longer be an illusion. I seized that so-called golden window, and connections quickly formed between my brain nerves, muscles, and joints. Weak signals gradually turned into the ability to move my limbs. If you want to enter a rehabilitation center for training funded by Social Security, Perquiso/Soxo, it can sometimes take 1 to 2 months to apply and secure approval. For bedridden patients with flaccid paralysis, if they do not receive any neuroplasticity training during this waiting period, their subsequent recovery outcomes will be far from ideal. If family members can find a qualified visiting therapist or traditional Chinese medicine practitioner during this period to conduct neuroplasticity training for the patient, it will significantly boost the efficiency of their later rehabilitation at the center. In my 4th month post-stroke, I entered a rehabilitation center for training 3 days a week, with sessions lasting no more than 3 hours per day. On days I didn't go to the center, I practiced at home on my own, doing the exercises I had learned there. However, in the earliest stage of neuroplasticity, especially within the first 3 weeks after onset, there is a principle against overtraining. When the affected limb is in a state of complete flaccid paralysis, zero muscle strength, do not rush into high-intensity weight-bearing or repetitive force stretching. Forcing the unaffected side to aggressively pull or swing the affected side sends out-of-control abnormal signals to the brain, which actually reinforces abnormal flexor spasticity patterns. This may have been the trigger for my early entry into the spasticity phase, overworking the affected side out of impatience. The correct approach: limit each session to a level that does not cause noticeable fatigue or pain. You can break it into multiple short sessions throughout the day, e.g., 5 to 6 times, lasting 10 to 15 minutes each, focusing on the quality of movement rather than the quantity. This is because neuroplasticity relies on repeated correct input rather than muscle endurance training. Rehabilitation is like driving a car on the road, while neuroplasticity is rebuilding the road to your destination. Without a road, neuroplasticity, no matter how powerful the car, muscle, is, it won't reach its destination. Therefore, in the early stages of recovery, all rehabilitation design must first serve the ultimate goal of guiding neuroplasticity, rather than simply chasing muscle strength or walking speed. Once you grasp this logic, the months of rehabilitation that follow will have a clear direction. Thank you.